So for this section, up until this point, we've focused on really the foundations of understanding psychosis, illness trajectories. Now we're going to shift towards a systems level question. How do we actually improve access to effective early psychosis care across an entire state? And so this section will introduce the STEP Learning Collab, or what we call the STEP LC, and the rationale for building this coordinated statewide approach, or what we call a statewide learning health system across Connecticut. So why build a statewide early psychosis system? So based on population estimates, as we had mentioned earlier, we expect roughly 500 new cases of schizophrenia spectrum disorders every year in Connecticut. And so if you think about if we're considering first episode psychosis within 3 years, you would triple that. So about 1,500 individuals at any given time experiencing FEP. And while many of these individuals eventually come into contact with mental health systems, they often do so late or after months or even years of untreated symptoms. And sometimes that's unfortunately through crisis-driven care, repeated emergency visits, hospitalizations, or significant disruptions in school, work, and relationships, as Dr. Srihari discussed when we showed that chart of a typical course. So the question really became, how do we create a more coordinated pathway into care across the entire state? How do we make it happen more quickly? And so that's really part of the rationale behind the STEP Learning Collaborative. And so as you look at this map, which we also have a link of, it's an interactive map that you can look at from what I'm showing here is DEMIS regions, and those little houses represent the LMHAs. And you can see the expected incidences of schizophrenia in a given region per year. But if you're interested and if you're a DCF clinic or someone else, will, you can look at this link and you can toggle it to look at the DCF catchment areas as well. So how are we addressing this issue of 500 new cases of schizophrenia every year? And so that, again, is where the STEP Learning Collaborative comes in. And I do want to show you this short 4-minute video. It can explain things much better than me. So we'll give this a play. If I can. Let's see. Oops. If I can't get this, I will pull it up on YouTube, but all righty. All right. I will pull it up a different way.
Psychosis. It's a scary word, but here's the thing. Psychosis is treatable. The earlier it's caught and treated, the better the prognosis. Psychosis is an early warning sign for schizophrenia. Unfortunately, many people face delays in getting the help they need, which leads to poorer outcomes. Disorganized systems often send these individuals down a pathway that delays immediate treatment, prolonging the duration of untreated psychosis. There are many key players that can unintentionally misdirect someone in crisis toward jail or a distressing and unnecessary ER visit before finally, potentially, getting help. Key players are all around us in our community. However, a shift in perspective can empower these players to actively become part of the solution instead. That's where the STEP Learning Collaborative comes in. STEP Learning Collaborative is a network of experts, clinics, and community members working together to reduce the time it takes for individuals to receive psychosis treatment. It all starts with a single call. anyone can call. A patient, family member, clinician, coach, anyone can reach out to the STEP Learning Collaborative referral line. They'll speak with an early detection and assessment coordinator who's especially trained to help. The coordinator connects the patient to the right clinic within one of 5 regions in Connecticut. From there, the coordinator addresses individual barriers that a patient might experience. This might include any issues a patient has with making it into their initial appointment with the clinic. The coordinator then monitors their progress via survey. But that's not all. The learning piece comes into play because STEP Learning Collaborative is designed to be a learning health system. That means it's not just about providing care, it's about learning from every patient experience to continually refine and strengthen the system over time. We use detailed assessments of patient outcomes across the network to determine what's working and what's not, to guide continuous improvement. And here's what makes it even more powerful. Multiple work streams are running in parallel, all working towards the shared goal of improving the system and ensuring everyone is learning how to improve the patient journey together. These work streams include educating community members, clinics, and family members to help with early detection, research to develop new treatments, assessment to continuously improve access and quality of care, and building sustainable and cost-effective models of care. At the heart of it all is the patient. Every learning activity is grounded in the patient's experience, with the goal of delivering more effective, compassionate care. The patient is not just the beneficiary, but the source of the insights that drive continuous improvement. The goal? To enhance access and quality of care by organizing a network of stakeholders into a coordinated system where everyone, from doctors to families to community members, work together to guide people towards the care they need faster and continuously collaborate to improve the quality of care. The result? A more responsive, coordinated system where people facing psychosis get the care they need faster, improving the outcomes for schizophrenia.
All right. So let me just switch back to. And no, just confirming you can see the PowerPoint slides.
I can, yes.
Great. Okay. So that we had that video created, and I think it captures the mission and kind of the patient journey really well. This slide is mostly for reference. I won't go into all of it, but I really wanted to emphasize that this STEP Learning Collaborative work, situating it historically. It didn't emerge quickly or in isolation. It's really the result of nearly 2 decades of partnership, research, and increasing intentional system design, always in collaboration with DEMIS, DCF, and most recently specific LMHAs across the state. We'll talk about the evidence for this specialty team-based care in more depth later, but the work really began in 2006 with the establishment of the STEP Clinic at Connecticut Mental Health Center. Again, this was a DEMIS-Yale partnership. And this early collaboration really laid the groundwork for testing whether a coordinated early psychosis care model could actually improve outcomes in the public sector. And through a randomized control trial, the STEP trial, we were able to show that coordinated specialty care or specialty team-based care was an effective approach for treating early schizophrenia. And it actually was a major impetus and became the national model for CSC across the US. Again, going through this quickly. Another aspect that we'll talk about is early detection. And so STEP also ran a trial, the first experimental early detection campaign in the US, and we were able to successfully have the duration of untreated psychosis across 10 towns in the greater New Haven area. We'll talk about a bit more of that later, but we again showed the kind of the evidence for a kind of community-based early detection approach and how we are able to kind of, again, shorten the time that it takes from the onset of psychosis for someone to actually get effective treatment. And so that really established the kind of the strong evidence base for the model that we would later hope to disseminate. And then many, meetings with DEMIS, DCF, strategic planning over many years. Fast forward to February 2024, we were able to launch the STEP Learning Collaborative statewide. And this is when you see the implementation of our centralized referral line that was discussed in the video, EDAC assessment, participation from all local mental health authorities, as well as various other aspects of the STEP Learning Collaborative to support provider workforce development, as well as stakeholder engagement. And this is actually an initiative that is reported on annually to the legislator about the progress of the STEP Learning Collaborative. So much of this was highlighted in the video, but really, to think about the major goal of the STEP Learning Collaborative is this vision of delivering safe, timely, and effective pathways both to and through care for every young person experiencing recent onset schizophrenia in Connecticut. Right? And so in order to do that, there's various work streams that were mentioned. I won't go into detail on all of them, but most importantly, right, we see improving access. So shortening that duration of untreated psychosis. So establishing streamlined pathways to care with low or no barriers, right? Getting folks into care quickly is so important. The collaborative also aims to really monitor and improve outcomes over time with a set of select population health kind of specified outcomes. Other things such as this training here today, right? Expanding workforce capacity through training, consultation, educational materials. We also do a lot of outreach to the community and value stakeholder inclusion, and other work going on to really support the sustainability of this initiative and these changes. So this map shows the statewide STEP Learning Collaborative Network and the participating local mental health authorities in regions across Connecticut. So many of you are very familiar with this. You represent these agencies, and STEP has regular meetings with representatives from each of these agencies every quarter to really talk about streamlined workflows for when we get a call about someone with first episode psychosis. How do we quickly and efficiently and safely get them into care at a local mental health authority near their home? And so it is important to recognize that we know that many individuals experiencing psychosis are already within your systems of care, whether it be LMHAs or DCF affiliated clinics. And that's why, community clinicians play such an important part in this role of early identification, engagement, and monitoring over time for young people with psychosis. And I will note explicitly here, although the LMHAs kind of represent the formal network, this is also a partnership with DCF. And so specifically in areas where the local mental health authorities are unable to serve folks under 18, we developing partnerships with DCF affiliated clinics in those areas to be the referral source and for those 16 and 17-year-olds. So to briefly look at, what it actually looks like when a clinician or a family member or a young person themselves, right, they call our centralized referral line, this number here. We also have an online referral form. And they get connected with one of our early detection and assessment coordinators. And so again, everything is meant to kind of move quickly, to not introduce additional delay. So they receive a rapid kind of screening and eligibility assessment. You can see the eligibility criteria for our network here. We focus on folks 16 to 35, approximately within 3 years of onset of a non-affective psychotic disorder, and they have to live in Connecticut. What is really exciting about this initiative and the support from DMIS and DCF and all of the LMHAs related to this is that this referral system works for anyone. There's no barriers related to insurance. So an individual can be publicly insured on Husky, they can have commercial insurance, no insurance, undocumented, whatever their status is, if they connect through the STEP Learning Collaborative and are determined eligible as being someone experiencing FEP, they can get care into these designated systems, which wasn't always the case. Sometimes, folks in the public sector would need to have public insurance, and they would unfortunately kind of bounce around between private practices or trying to kind of cobble together care and not be able to reach it until many years later when they potentially end up on public insurance anyways, and then they're much further along in their course. So this is a huge shift and one that we're really excited about for LMHAs to be taking these young folks into care even earlier in their course. Other things that the STEP LC and the EDACs do, they provide an initial evaluation and then support ongoing assessment every quarter. And it's more than just a referral, right? This is a very active engagement. When someone calls and connects with the EDAC and they're eligible, we're really making sure that warm handoff happens to the LMHA. We're following up on engagement. We're providing psychoed to the family. In the meantime, we're orienting them to crisis resources or educating them about ansoagnosia or limitations in insight and helping them think of ways to kind of help support their young person connect to care. And so I had already alluded to this in that timeline table, but this notion of early detection. So when we talk about early detection, the primary goal is to reduce DUP, or the duration of untreated psychosis. And again, this is shortening the time that it takes from when someone first starts experiencing full or frank psychotic symptoms. So remember that continuum I showed you, when they're at that point where there's full conviction or significant interference or disruption due to the symptoms. So DUP would be from the time that they experience those symptoms till they reach appropriate care. And we know that without clear pathways, people often enter the system late, or as we mentioned, through crisis-driven routes, including emergency rooms, involuntary hospitalizations, or unnecessary criminal justice interactions. So early detection is really about changing those pathways. And so the statewide early detection campaign, again, based off of that trial that STEP ran from 2014 to 2019, and that was based off of the TIP study that was run in Norway. It takes a three-pronged approach. So I'll try to kind of just simplify this, but if we're thinking about the early detection efforts, three different areas. The first being a mass media approach. So as you can see through some of the images here, we're using transit ads, billboards, social media, news segments, all ways to kind of create a clear call to action when concerns arise. So as you can see, we've got feel like your mind is playing tricks on you. So it has something that kind of grabs attention, either explicitly mentions psychosis or alludes to it, and then immediately gives a clear call to action. We don't expect the public or even other clinicians to necessarily make those differential diagnoses. The main point of some of these ads and mass media outreach is really to help increase recognition of psychosis and then activate a clear call to action, which would be calling us and kind of letting us do the work, letting us figure out what's going on. And I didn't mention this previously, but of course, many people who call the referral line are ineligible. They don't meet that criteria. And we work very hard to still try to connect them to appropriate resources across the state. So the first arm was mass media. Second is targeted outreach and education to groups that are likely to encounter early psychosis early on. So this is where we're thinking about, okay, who's interacting with these young people? So this is schools, colleges, first responders, hospital, primary care, mobile crisis teams, really anyone who might kind of come into contact with a young person in this age range. We want to be reaching out to, educating. And so we kind of call that professional outreach and detailing. And a lot of times that is kind of also going to inpatient units and hospitals and making sure that they're aware of the resources that are available. And third, which none of this kind of works without, is rapid access to care. So this is really anchored by that centralized referral process and the close partnership that we've built with the LMHAs and other community agencies. Because early detection only works if recognition can quickly lead to connection to care. And so the goal is to connect people within 7 days or less from the time that they're identified, right? Long wait lists can be catastrophic for this population, right? So, a lot can happen during that time where someone is potentially waiting for an appointment. You might lose out on that window of their willingness to accept treatment, or like we said, other difficult and unnecessary interactions might happen. So I'll highlight a couple pictures here that really show a lot of the work that's happening both from the STEP Hub team as well as activating kind of LMHAs and other community members. We have a dedicated member of our team, Carrie Villette, who is our liaison to first responders. She does incredible work developing relationships with law enforcement, mobile crisis teams, public safety networks across the state. She is now integrated with the monthly CIT trainings that are held for officers, and she provides a specific segment focusing on how to respond and communicate with individuals experiencing first episode psychosis in a crisis, and just a lot of other work. We also have a dedicated member of our team, Josina James, who's our director of social work, and she is leading the efforts on kind of educational outreach at every level. High school, college, vocational training. We're out kind of boots on the ground at fresh check days. We've got our information in college counseling centers across the state, and are continuing to kind of do things to reach these specific stakeholder groups. And there's various other ways in which the team is leading early detection efforts, as well as encouraging LMHAs in their local communities to kind of get out into the community and also encourage early detection of psychosis. So we already saw one of the really wonderful videos that highlight some students with psychosis lived experience, but I wanted to point out that it's important to kind of put those voices at the forefront and amplify their messages. So we were able to, again, collaborate with Red Rock Branding and create 24 interviews of individuals with lived experience of psychosis, and those are available on our STEP LC YouTube channel. Really helpful, I think, both for providers, families, but also for young people themselves. If you're looking for a story, different types of representation to show some of your clients that, recovery can look a lot of different ways. I highly encourage you to have them get connected with the Students with Psychosis Network, but also check out some of the stories on our YouTube channel. In this slide, I really already covered how kind of early detection and the STEP Learning Collaborative depends on partnership across stakeholder groups. So this is just a visual that we use, and we kind of orient some of our strategic outreach efforts around really trying to connect with all these different buckets of groups and make sure that they have tailored messages for them about understanding what is early psychosis and how to help connect to care. And many of you in this audience, right, fall into at least one of these buckets and are really important in early detection efforts and improving care quality for this population. So I do want to take a moment at the end of the section just to show some pictures and names of the multidisciplinary STEP Learning Collaborative kind of hub team. This work really spans psychiatry, psychology, social work, nursing, outreach, informatics, young person and peer-informed programming, and yeah, wouldn't be possible without all the folks pictured here, as well as many others. So to end this section, again, this is largely just resources for you, but there were some questions that came up in the chat. How do I refer? Certainly the phone number or the online referral form, everything is on our website. The YouTube channel is a really nice archive of all trainings, interviews. But if you want to stay up to date. The email list is actually the best way to do that. We send out a monthly newsletter that will link to the latest recordings of trainings, any new tip sheets that we have coming out. So I think you saw on one of the slides, there's a tip sheet about cannabis and schizophrenia and statistics and risks. We develop a lot of different educational materials, and it's just keeping you up to date on all of that.